Okay, my name is Sherri Spinos. I'm in Nursing Assessment 302 with Miss Carrie Fiore. I'm going to be doing the cardiovascular and vascular assessments. And my patient here, I'm going to explain to her that I will be looking at her head, neck, and extremities to provide clues to cardiac function. I will ask the patient, she's already sitting down, but I'm going to ask her also to lay down as part of the exam. And I will be touching the neck, chest, as well as tapping on the chest. I will be inspecting the patient's face, lips, and ears and scalp looking for cyanosis. No cyanosis. I'm going to look into the eyes and the tissue surrounding the eyes. The sclera should be whitish in color. The conjunctiva should be clear, eyelids smooth. I will inspect the lips, the buccal mucosa, gums, and tongues, checking for any cyanosis. Open up your mouth. Okay, no cyanosis. Okay, I'm going to inspect the jugular veins. And this is information about the central venous pressure and the heart's pumping efficiency. Turn your head slightly this way. Okay. I'll be inspecting the carotid arteries and doing the carotid pulsation at a 45-degree angle. Okay, I'm going to be checking the carotid arteries, and I have her laying in a 45-degree angle, and I'm going to use measure the first ruler at an angle of Louis and place the second metric ruler horizontally at a 90-degree angle. One end of the ruler should be at the angle of Louis and the other end in the jugular area on the lateral aspect of the neck. And this measures to the sternocleidomastoid muscle. And everything's fine there. There is no distension of the neck veins that would indicate elevation of the central venous pressure, commonly seen with congestive heart failure, fluid overload, or pressure of the superior vena cava. I'm going to again ask the patient to sit up in a sitting position, and I'm going to inspect the hands and fingers. Okay. And I'm inspecting the client's chest. There are no masses or bulges present. Okay, I'm sorry, I'm going to have to ask you to lay down again, and I'm going to check the patient's abdomen for any pulsations. Okay, no pulsations. I'm going to check the legs for hair distribution and any swelling. Okay, and I'm going to palpate the chest. And starting over here. And moving down. I'm going to palpate the carotid pulse. And use percussion. Place the middle finger at the nipple, line at the left chest wall. And I'm going to also take now the heart lines, or the heart sounds. Okay, I'm going to listen by telling her to hold her breath with the bell side, and then using the diaphragm, compare the carotid pulse with the apical pulse. Hold your breath, please. And I'm going to check your carotid pulse too. Okay. Okay, now I'll be assessing the blood pressure. This is part of the vascular portion. Okay, good blood pressure of 118/78. I'm going to be taking it in both arms, sitting and lying down to compare the readings. Okay, 116/74. I'm going to have her sit up, and I'll do compare the readings. Okay, 122/80. and 124/76. Okay, moving on. The blood pressure normally does not vary more than 5 to 10 millimeters of mercury, so she was right on target there. I'm going to palpate the carotid pulse and ask her to turn slightly toward my hand. The rhythm is good, regular. I'm going to ask her again to hold her breath. I'm going to also take the carotid pulse using the diaphragm of the stethoscope. And the pulse is regular. I'm checking now the hands and applying pressure to her fingernails for 5 seconds for capillary refill. And it returns within 3 seconds. I'm going to palpate the radial pulse and also the brachial pulse. And again, the heart rate is regular and even. And the brachial pulse. I'm going to perform the Allen's test now to see if there's any obstruction or insufficiency of the artery in the arm. This is called the Allen's test, and I'm going to ask her to have both arms with palms up on her knees. And I'm going to compress the radial arteries of both wrists with the thumbs open. With her thumbs open, good. Compress the radial arteries of both wrists with your thumbs. And I'm going to ask her to open and close her fist several times while still compressing the radial arteries. The palm should become pink immediately, indicating patient ulnar arteries. Next, I'm going to include the ulnar arteries and repeat the same procedure to test the patency of the radial arteries. So I'm going to compress the ulnar arteries and ask her to do the same thing by compressing. And they do pink up. So there is no occlusion in the ulnar artery and the radial. Okay, moving on to palpate the epitrochlear lymph node in each arm. This node drains the forearm and the third, fourth, and fifth fingers. I'm going to hold the client's left hand, and check behind the elbow to the groove behind the biceps and triceps muscles. I'm noting the size and consistency of the node. Normally it is not palpable or is barely palpable, and there are no enlarged lymph nodes here. And I'm going to palpate the axillary lymph node with the palmar surface of her fingers, and I'm going to check deep into the axilla and check to see if there's any along her rib cage. Okay. And there is no any enlargement of the lymph nodes. Okay. I'm going to move on to the legs now. Inspecting the legs again. Everything looks normal. The temperature is warm. And no unusual veins, protruding veins. Okay. Pause it a minute. Sorry. Next, I'm going to check the patient's Homan sign. She is in a supine position. I'm going to flex her knee slightly at a 5-degree angle and ask her to sharply dorsiflex her feet towards her. And do you have any pain?
No pain.
No pain. So that is a negative Homan sign. I'm going to move on and palpate her femoral pulses and her popliteal pulses behind her knee, which I'm going to check first. The popliteal and the pulses are regular and palpable. And I'm going to move on to her femoral pulses. And the pulses again are regular and palpable. I'm going to palpate the dorsal pedis pulses, both on the top of the feet here, and also the posterior tibial pulses. And both pulses are present and regular. I'm checking for the posterior tibial pulses now on each ankle. Both pulses are present and regular. I'm going to check for lower leg muscle strength and test her leg sensation. Can you push against my hand? Good. Good strength. The other leg. Okay. As I was checking the legs before, there was no edema, and I have to take off her socks and check for her toenails. Normal. And I just want to go back to the heart assessment one more time. And I'm going to do... I just want to briefly go over the characteristics of heart sounds. I think I should touch upon that. I'm going to listen to her heart sounds one more time and just try to hear the lub-dub, the S1 and the S2 to make sure everything is normal in there. And I do hear a regular heart sound, S1 and S2. No abnormalities. Okay, that concludes my cardiovascular assessment and peripheral vascular assessment. Again, my name is Sherri Spinos. Thank you.